Thank you for joining our Debbie's Dream Foundation Curing Stomach Cancer webinar on the role of nutrition for cancer patients. When diagnosed with cancer, nutrition becomes even more important. Good nutrition can help you feel better, reduce the risk of infection, keep your strength up, and help you heal faster. During this informational webinar, you will learn the building blocks of a healthy diet as well as the nutritional needs throughout treatment. I am Margaret Meyer, and I will be moderating today's webinar. I am the Patient Resource Manager for Debbie's Dream Foundation Curing Stomach Cancer. I'm a licensed marriage and family therapist and currently completing my doctorate. My clinical and research background is focused on working collaboratively with doctors, patients, their families, and members of the healthcare team. We would like to thank Genentech for providing funding to make this webinar possible. We would also like to thank our promotional partners, the American Association for Cancer Research, the Anti-Cancer Club, Cure Magazine, the Esophageal Cancer Action Network, Meals to Heal, and Patient Resource. You will be able to ask questions during this presentation. You can type your question into the white text box that appears on your screen. At the conclusion of the presentation, we will address questions as time allows. If we don't have time to address your question today, we will try to address it during our next webinar taking place on June 10th at 12 noon Eastern Time. In addition, the recording of this webinar will be accessible on our website in approximately 1 week. Now I will introduce Debbie Zellman, who will share with you her journey and information about Debbie's Dream Foundation. Then Dr. Cindy Collins will present the role of nutrition for cancer patients. And then there will be a time for a question and answer session at the end. I would now like to introduce the president and founder of Debbie's Dream Foundation, Debbie Zellman.
Thank you so much, Mary Margaret, and welcome everyone. I was diagnosed with stage 4 stomach cancer in April of 2008 when I was only 40 years old. I was the mother of 3 young children. I was married to a physician, and I was a practicing attorney with my own firm. At that time, I had no risk factors for stomach cancer, and my symptoms were very vague. My chances of being alive in 5 years was only 4%. I'm happy to tell you that it is now 7 years since my diagnosis, But I also want you to know that in that time, I have had 5 recurrences, and I'm still a patient who receives chemotherapy. Next slide. In the 7 years since my diagnosis and the 6 years since founding Debbie's Dream Foundation Curing Stomach Cancer, which was in April of 2009, I've become a big advocate for stomach cancer. I serve as the patient advocate on the National Cancer Institute Esophagogastric Task Force. I'm on the NCCN Gastric and Esophageal Guidelines Committee. I'm on the Department of Defense Peer Reviewed Cancer Research Program Integration Panel, the American Society of Clinical Oncology HER2 Testing Guidelines Gastric Cancer Project, the National Cancer Institute Patient Advocacy Steering Committee, and the American Cancer Society Research Stakeholder Program. The foundation is also a member of the Deadliest Cancers Coalition, the Patient Equal Access Coalition, along with the State Patient Equal Access Coalition, as well as One Voice Against Cancer. But people tell me my most notable accomplishment has been that I appeared on Dr. Oz in a program about stomach cancer. Next slide. So here's some facts about stomach cancer. Stomach cancer is one of the leading causes of cancer death worldwide, second in men and fourth in women. And each year, nearly 1 million people worldwide will be diagnosed with stomach cancer, and approximately 700,000 will die. More than 24,000 Americans will be diagnosed each year with stomach cancer, and more than 11,000 will die that year. Stomach cancer is on the rise in young people ages 25 to 39. However, per cancer death, stomach cancer receives the least amount of federal research funding of any cancer. When I was diagnosed, there were certainly few resources and support services for stomach cancer patients, and most people knew very little about this deadly disease. Next slide. Which is why I started the foundation. Debbie's Dream Foundation is a 501c3 nonprofit dedicated to raising awareness about stomach cancer, advancing funding for research, and providing education and support internationally to patients, families, and caregivers. Debbie's Dream Foundation seeks as its ultimate goal to make the cure for stomach cancer a reality. Our website is www.debbie'sdream.org. www.debbiestream.org. Next slide, please. So on that website, we have lots of resources, including a patient resource education program that's abbreviated PrEP, which prepares you for the journey that you are about to embark on. It helps hundreds of patients, families, and caregivers throughout the world, and it matches the inquirer, which could be a patient, family, caregiver, or loved one, with another stomach cancer survivor or caregiver using specific disease criteria such as stage, biomarker, age, gender, and region. We also offer free stomach cancer symposia and webinars like this one throughout the year. Our latest symposium was just on April 18th, and those lectures should be available shortly on our website. We have 26 chapters in the United States, Canada, and Germany, and events that occur all across the United States. We have given away $150,000 in research grant funding, and we've also been staunch advocates. We have had 3 stomach cancer Capitol Hill advocacy days and the first ever stomach cancer Capitol Hill briefing. Our advocacy efforts have been so successful that we were able to have stomach cancer added to a $50 million pot of money to the Department of Defense peer-reviewed cancer research program. In addition, our website is just very rich in information. There's stomach cancer 101 information, a lecture library, clinical trial information, and a matching service, all free. There's an incredible and unique stomach cancer support community, blog topics, and resources, all of which are completely translatable into more than 60 languages. And again, the website is debbiestream.org. Next slide. Here's a little picture of the homepage of our website, just so you can see. It's a very user-friendly website. We welcome everyone to visit it. Next slide. This is just a little snapshot of just a few samples of the events that we have coming up, including a meeting. We attend lots of scientific meetings, so we're going to be attending the American Society of Clinical Oncology meeting in Chicago in May. We are participating in the National Cancer Survivors Day, which is a celebration of life, on June 7th. And we do that through Debbie Stream and encourage everyone to do that. We have a Chicago half marathon and 5K on September 27th, as well as the Chicago Symposium on November 7th. There's an International Stomach Cancer Genes Day that everyone can participate in. It's very easy and fun on November 13th. And the Miami Marathon and Half Marathon on January 24th. There's a lot of other events that are happening as well, and you would just, again, check out the website at wstream.org and look under the Events tab. Thank you all so much. I'm going to now turn over the webinar back to our moderator, Margaret Kilmeyer. Thank you so much.
Thank you, Debbie. Debbie Stream Foundation is headquartered in Davie, Florida. Our office is open from 8 a.m. to 5 p.m. Monday through Friday. On this slide, you will also see important phone numbers and email addresses that you can contact our office. We will now start the presentation on the role of nutrition for the cancer patient. Our presenter is Dr. Cindy Collins of South Florida Radiation Oncology. Dr. Collins graduated from the University of Florida with a degree in biology and continued her master's in human nutrition. Cindy earned her PhD in experimental psychology, researching hope, coping style, quality of life, knowledge about cancer, and risk for dietary deficiency in patients with total gastrectomy for stomach cancer. She is a registered dietitian, licensed in the state of Florida, and board certified in oncology nutrition. She currently works at South Florida Radiation Oncology, where she works with both individuals and groups. I would now like to turn the webinar over to Dr. Cindy Collins.
Thank you for your kind introduction. Are you able to hear me? I was having a little bit of trouble.
Yes. Thank you so much.
Okay. All right. Thank you. Okay. Thank you, everybody. The first slide you're seeing is a display of protein. The reason I chose to start the webinar with protein is because it really is the most important macronutrient, specifically for cancer patients and especially for patients who have stomach cancer. So you're seeing a variety of fish there because those are lower fat and healthy fat proteins that you should be eating. And I'm trying to show you also a really good variety, even of the type of fish and the vegetables that go with it. It turns out the variety is the best way for you to get the various vitamins and minerals that you need. And it's really difficult sometimes as a cancer patient, especially especially while you're undergoing treatment, to get a good variety of food. Sometimes your diet gets very narrow, and as much as possible, you need to keep a good variety of foods coming in. Next slide, please. Okay. Why proteins? Why are they so important? Well, they do make up every single cell, tissue, and organ in our body, and you're constantly breaking them down and losing them and needing to build back up new tissue. You need this for wound healing. You need this for really withstanding your treatment, especially if there's any destruction of tissue, if you're having any areas where you get mouth sores or any kind of openness or with your skin, because you're very likely to get an infection at that point. So proteins become antibodies. That's why you see immunity on that slide. They also enable you to keep your muscles strong. Otherwise, you'll have some muscle atrophy during treatment. And they're important even for simple things like enzymes, for your water balance, to keep normal hormones, and to keep your skin healthy and intact. Next slide. The question we usually have is, well, how much protein should I be eating? And how do I know how much I'm getting? So if you have a dietitian at your disposal, it's a great idea to visit them. They'll be able to figure out and calculate the exact protein needs that you have, as well as how you can get that in your diet. But this example here gives you sort of a general idea. Most individuals who are weighing between about 120 to 160 pounds need a good 50 grams of protein. If you are a cancer patient on treatment, your needs will go up markedly. So that's a good thing to get figured out individually for yourself. But you see here that 3 ounces of chicken breast will give you 26 grams of protein. If you go down to beans, which are an excellent source of plant protein, you're getting a little less. You're getting 16 grams for a general serving. And even milk gives some protein, but again less. Quinoa and orzo are 2 grains, basically, that we eat that have less protein content. But they're still a pretty good source if you have enough volume of them in your diet. So it's a good idea not to only focus on the meat, the chicken, and the fish. Sometimes you need to focus on some alternate sources of protein as well. As you can see here also, usually vegetables and fruits are giving you a lot of protein. Next slide. All right, this again is showing you other sources of protein. So I want to make sure, especially if you are practicing a vegetarian diet, that you don't forget that beans are a really good source of protein. They typically need to be coupled with some rice or other grains in order to get all the protein that you need. For example, red beans, kidney beans, black beans, pinto beans, they should also be eaten with rice to have what we call a complete protein in the meal. And something like peanut butter should be on whole wheat bread, making it a complete protein. Other nuts that are very important, as you see there, are almonds, walnuts, even pistachio. In fact, they also, in addition to protein, give you very healthy fats. And then I've included some cheese and tofu in the top and the bottom slide there. If you're a lacto-ovo vegetarian, you're including some cheese and you're including eggs in your diet, just not including other animal meat. So it's easy to get your protein, or easier to get your protein as a lacto-ovo vegetarian. Next slide. This really colorful slide is designed to show you how important color is in your diet. The pigment in your vegetables and your fruits is actually where you're getting all your antioxidants and a good variety of your other vitamins and minerals. So I've included juices. Typically, you want to dilute the juice. You really don't need the extra sugar content of a fully concentrated juice. And then I've included things like berries and kiwi because there's so much fiber and so much water in those fruits. They're getting a lot of your nutrients along with the fiber and water, which keeps your glycemic load down. Some of your other fruits are so high in sugar, we want to be careful not to concentrate too much on those. And then on the left bottom, you're seeing carrots, turnips, tomatoes, cucumbers, zucchini, all of the pigment, again, all of the colors, the blue, the red, the green, the yellow, the orange, all of those colors are very important, along with blueberries and blackberries, in order for you to get high antioxidants. Next slide. One example of an antioxidant is vitamin A. Vitamin A is in a wide variety of fruits and vegetables, very high in sweet potatoes, carrots, all your dark green leafy vegetables, and even in some of your fruits like mango, apricot, and cantaloupe. It probably is unnecessary to take a supplement of A, and if you happen to be on radiation, it's not a good idea, it's contraindicated. So instead, you should look for vitamin A and some of these other antioxidants in your food sources rather than take supplements. Next slide. Vitamin C is another really important antioxidant. I know typically we think of vitamin C as preventing colds or preventing some illnesses, and that's really because it does boost the immune system, but it also is generalized in the body as a very important antioxidant. I know usually we're also thinking of citrus fruits, but vitamin C is high also in broccoli, high in the berries, especially strawberry, and even high in other cabbages and also in the white potato. So it shouldn't be hard to get a good, healthy source of vitamin C in your diet. Next slide. Vitamin E is the third antioxidant we're talking about. This is found in a little bit different foods. You're seeing E mostly with the oils or the fats. That's why you see it in vegetable oil. You see a healthy dose of vitamin E in nuts and seeds and wheat germ, if you add wheat germ to your food. Even olives will give you vitamin E, a little bit out of leafy greens and asparagus and avocado. But typically you need to have a good source of oils in your diet for vitamin E. Next slide. The last antioxidant that I'm addressing is not a vitamin, but it's a mineral. And it's the mineral selenium. We don't hear a lot about selenium, but it's a very important antioxidant. Again, it also is important for your immune system. You find selenium easily in any whole grain, also in certain fish, especially in salmon, as we're showing here, and in eggs as well. That 150 micrograms is a very tiny dose. It's a very, very small amount of selenium. That's your daily requirement. But don't be deceived by that. Even these tiny amounts are very vital and very important in your body as antioxidants. Next slide. All right, this slide is designed to show you that it definitely is okay to eat dairy. I know there's been some question about dairy and whether it's a pro-oxidant causing oxidation or whether it's okay as far as inflammation. Dairy is a very, very mild inflammatory or oxidative process, so it really isn't a concern for cancer as long as you don't go overboard on your volume. So I'm showing milk here. You can choose to do a non-dairy milk if you want to, like almond milk, but you're safe with a dairy milk as well. Cheese is included and also yogurts. Yogurts are especially important because they have some probiotic in them. So nearly all yogurts on the market do have active culture, and that active culture is going to help you restore and maintain the normal bacteria, or what we call the normal flora in your gut. A very important thing to do, especially if you are on treatment. Next slide. This is an example of all the calcium-rich foods. So one of the additional things that dairy can give you is extra calcium. Certain patients, breast cancer patients, are in need of extra calcium. Also, stomach cancer patients need an extra dose of calcium in their diet because they have absorption difficulties. So what I'm showing you here is that you have your usual sources in the middle, the dairy sources, the one we think of all the time for calcium. But you have other sources too. On the far left, you'll see the dark green leafy vegetables are actually really good sources of calcium. Even kale, 100 milligrams per cup, that's a pretty high level of calcium. There isn't as good absorption of calcium in your vegetable sources as you have in dairy, but there's still a good source. You still want to include them in your diet. Options that we don't normally think of are even some of the seeds, like sesame seeds and flax seeds, even figs, even garlic has a little bit of calcium, as you can see there. And then there are some products on the market where they've added calcium. So where you see orange juice, calcium and vitamin D fortified, that actually is regular orange juice where the manufacturer has added some calcium and added some vitamin D, and they've done that to increase the absorption rate of the calcium. Next slide. Iron is another very important nutrient. Iron is a mineral, and it's very important for cancer patients. Typically, your CBC or your blood count is being monitored if you're on chemotherapy. It's not usually an issue if you're on radiation therapy, but in general, you just need to be sure that you have a good dose of iron in the diet. You don't need to take a supplement of iron unless the doctor has taken your blood and actually sees that you're anemic or you're low in iron. But you do want to make sure that in your diet you're getting enough of the foods that naturally have iron. It turns out that heme iron, so iron that's already in an animal product, is your best absorbed iron. If you're eating some sort of animal product, poultry, meat, fish, and also along with the B12 that comes in the animal products, you're going to have really good absorption of your iron. But you don't want to exclude your plant sources of iron. They're called non-heme iron. It's iron that's in a non-animal product, so they're in plants. You don't absorb them as well, but you still want to have it in the diet because you have other things that are in those foods that are along with the iron that help you with absorption. If you're worried about getting the iron increased in your blood, you know that you've been anemic and you're trying hard to absorb more, you'll want to eat your non-heme plant sources of iron along with something that's heme. So you put the two together like you put a grain or a bean with a meat or a chicken source. Or you eat the non-heme iron along with some vitamin C. So you could squeeze some lemon on your grains or on your vegetables, or you could eat some other foods that would have some citrus in it, like even a glass of orange juice or any other citrus juice, and that would enhance your iron absorption. Next slide. This again is telling you about the bioavailability, which is the absorptive quality of the non-heme iron. And we're again showing you some more pictures where you can combine the vitamin C with heme iron and actually also sugars that are in some wines. Put those together with your non-heme iron, which is in the plant source. And each one of these meals is designed to enhance the iron absorption from the plant source of iron. Some of those examples then are fortified cereal, with fruit in the cereal, or high vitamin C vegetables garnishing a bean soup, your leafy green salad, and add a little fruit, like add mandarin oranges or slices of strawberry or blueberries. That will increase the iron absorption. And for any of the vegetables, if you add meat, chicken, or fish, you're going to again increase your iron absorption. This way you can eat a variety of foods, but really optimize the amount of iron that you absorb from the food. Next slide. These are some of the things that could cause you to lose your appetite while you're going through treatment or after you've been diagnosed with cancer. Biologically, you have an increased requirement for energy, so your body starts to change actually the way it manages the nutrients that are being digested and absorbed. Physically, treatment as well as other activities that you need to do that go along with having cancer, like especially a surgery or anesthesia, that can sometimes work against you and decrease your appetite. And emotionally, there's a lot of anxiety that patients will experience, and so also sometimes depression, just with the diagnosis of cancer, which again can affect your appetite. It can turn you off from eating, make it difficult to think about food or prepare for food. If you're not getting your nutrients, some of your other basic functions in the body, like your heart, liver, and kidney function, will be impaired, and you might even have trouble fighting off other infections. So it's extremely important that you monitor your appetite and find a way to work with whatever these causes are, so that you again get a good, healthy dose of all the nutrients that you need. Next slide. A typical problem with cancer, but not for every patient, is that they'll experience some weight loss. So here I've given you a few different ideas. I'll touch on the more important ones. If you are experiencing weight loss and you actually are not having a good appetite, it's not a good idea to suddenly try to make yourself eat a lot of food. So eating small meals throughout the day usually is more successful in getting the nutrients that you need. If you have a problem with food odors, which can happen with chemotherapy, eat the food cold rather than warm. even room temperature is better as far as not having the unappetizing odors bothering you. And also make sure that your meal time is very relaxed, that you don't have a lot of stress, that you don't put a lot of pressure on yourself with eating. If you know a time of day where your appetite is better, that's the time you should make sure that you're eating. Next slide. Food odors, again, can be an issue. Occasionally, there's certain triggers, certain foods that are problems. So you might want to stay out of the kitchen where somebody else is cooking. You can also put essential oils, just a tiny little dab of the oil under the nose, on the skin above your upper lip, and that helps you to not smell the food, but actually block your ability to smell if you really are being bothered by food odors. Next slide. Another common side effect while on treatment for many patients is nausea. Typically, you'll have a nausea medication, but you may have what we call some breakthrough nausea. It's a good idea to keep ginger on hand. It's an excellent way to combat your nausea. You can get ginger in pill form. You can use real ginger. You can also drink ginger tea. Also, keeping yourself upright after eating, using a straw helps. Dry foods, even a little bit of salty foods can help often with nausea too. Next slide. Our next way to avoid nausea is to make sure you keep on hand your toast, crackers, popsicles. Very bland foods is what you see listed here. Non-spicy, very low fat. You wouldn't want anything greasy or fried, or actually even anything too sugary either when you have nausea. So you're looking for options that are bland, low sugar, and low fat. Next slide. Hydration. I love this slide, besides the fact that it looks really pretty, seeing the water. It's so important. It's one of the things that we often neglect. Hydration is important for everyone, but especially important for cancer patients. You need even extra water when you're undergoing cancer treatment because you're utilizing more water with all the body processes. If you're turned off to water, you don't have to have just simply water to drink. Anything that's not caffeinated and that's fluid is considered hydration. It's when it's caffeinated that it doesn't count as water or count as your hydration, but your non-caffeinated drinks are also allowed. Next slide. Tea is also very important. We all, of course, are interested in drinking green tea. White tea and black tea are just as high in antioxidants as green tea is. And you want to be really careful if you're looking at your tea for hydration to make sure it's a non-caffeinated tea. Even green tea comes caffeinated, so you'll have to carefully read the box to know that you have a non-caffeinated green tea. And just the act of drinking tea can also be very relaxing, which is important. And it also, for some people, stimulates the appetite. Next slide. Diarrhea is an unfortunate and somewhat common side effect depending on your treatment regimen. It's something that you might have temporarily during treatment or something that you might unfortunately suffer with a lot. The most important thing if you are having diarrhea is to replenish your fluids. That really is the most important and first thing that you should do. So I've listed here that you should have fluids, that even diluted juices or broth count as your fluid, and that you need to drink fluids at room temperature. It's a lot easier to get more of the fluid in when it's room temperature. Next slide. Constipation is the alternate, of course, opposing symptom that you may have, and typically to have relief from constipation, you need a certain amount of fluid in your diet as well as some fiber. You don't want to go over on the fiber. And also, you want a little bit of oil on the diet. You need movement as well. Very often with cancer treatment, you're fatigued or you're even sleeping more. You need to make sure that every day you get enough movement so that you keep the good tonicity or tone of your GI tract. Then prunes, carrots, potatoes, these types of grains, well, as long as you have the skin on the potato, will help you to keep a good bowel movement. And you're still aiming for 1 per day. Next slide. Mindfulness eating or mindful eating is very important. This is a new concept that you've probably read a lot about. The idea of being mindful or being in the moment and really appreciating your food. if you're very turned off to food or having mouth sores or difficulty chewing or swallowing, this requires some deep breathing, some relaxation, a new mindset actually in eating. But it's really important to have knowledge about what you're eating, how it makes you feel, what the nutrient level of your food is. Going through cancer is a time to pay special attention to your environment when you're eating, as well as your approach to eating. Next slide. I want to press that you need anti-inflammatories in the diet. Earlier we saw antioxidants. The two main features that we're looking for a cancer diet is antioxidants and anti-inflammatories. These oils, vegetable oil, olive oil, the oil that comes in nuts and avocados, those are all very healthy oils. Not only are the right oils for heart disease, but they also help with mood, they help relieve fatigue, and they're especially important for cancer patients. Next slide. More sources for your anti-inflammatories, and these are spices: ginger, cinnamon, basil, cumin. The most important spice right now that has the best research, the strongest data, is turmeric. Turmeric is in curry, but you don't have to eat curry to get turmeric. You can actually get just turmeric. You can find it in the root form. You can find it on the spice rack in the regular grocery store. And the active ingredient of turmeric, which is called curcumin, has some very strong data behind it as being an anti-cancer, anti-inflammatory product. Next slide. These are the resources that I think are very reliable with information for nutrition. They're not the only ones. There are other good sources out there, but I wanted to at least give you a list of those that you can rely on to be adequate as well as being credible. So important sources, especially at the lower end, MSKCC, that's Memorial Sloan Kettering Cancer Center. Their resource on their website has a very good section on herbs. So if you're considering using new herbs or adding additional herbs into your diet, you'll want to take a look at this website. It will tell you not only if there are any reported harmful side effects, but also what the actual action of the herb is. And that ends my my slideshow here today. Do you have any questions for me?
Thank you so much, Cindy, for your presentation and that information. I will now begin reading some of the questions that we've received during your presentation. So the first would be, how does a gastrectomy affect the absorption of the non-soluble vitamins? And what are necessarily, how does the limit change for those in a gastrectomy patient?
Okay, so the question is, with the gastrectomy, is there change in the absorption rate of your non-soluble vitamins and minerals? Yes, there. With the total gastrectomy, we see that nearly all nutrients are only absorbed at 50% of what they had been absorbed. So already you need more nutrients coming in total, but especially calcium, iron, vitamin B12. These are nutrients where the absorption rate specifically goes way down. So for B12, we usually recommend, especially with a total gastrectomy, that someone has an injection of B12. It's almost impossible to absorb your B12 because you don't have intrinsic factor, which you would have had if the stomach were still present. Even with a partial gastrectomy, it's probably important to have either a sublingual or an injection of vitamin B12. Calcium and also iron are also two more nutrients that you're at risk for deficiency. So supplement doses are almost always necessary. They're probably a good insurance to take a supplement dose of vitamin C along with calcium and then also your iron.
Okay, thank you. Can you talk a little bit about the dietary limit for dairy? Does that change with gastrectomy, or perhaps maybe with the pro-inflammatory foods in general?
The change for dairy with a gastrectomy has more to do with function. When the stomach is not present, either all or part of it, you have what's called a dumping syndrome. So typically what happens is you don't have the reservoir in that you normally had with the stomach, and you get a lot of gassiness, a lot of cramping, after a meal. So many patients switch to a lactose-free or a lactate milk, and they slow down on the dairy a little bit just because of the lactose that's naturally in dairy. Besides that, the pro-inflammatory quality of dairy is actually not strong enough to be a concern with the gastrectomy patient. And your dairy is a good source of water, milk is. It's a good source of water and a good source of probiotics. Most of the gastrectomy patients I work with are using yogurt as a way to moisten and put almost like a vehicle for the food. They'll mix in their beans, they'll mix in their rice, the other things they're eating with a coating of yogurt because they get probiotic back into their system. It also helps the food to slide past the anastomosis or the scar tissue where the surgery was done, and it's an extra good source of calcium as well.
So to piggyback off of that, would you recommend adding a probiotic in?
I would. If somebody's not eating a lot of yogurt or other fermented foods, which would be like sauerkraut, then I would definitely recommend that they have a probiotic. And if you haven't had one in the past, you want to start with what we consider a lower probiotic count. So the organisms in a probiotic actually come in the billions. So when you purchase one, it'll tell you how many billions are in each capsule. And you want to start at one that is between 5 and 10 billion on the count. That's considered, believe it or not, a low level. And you probably don't need to work up any higher than maybe 20 billion total in your diet. How will you know? You'll know mostly by symptomatology. So you'll want to make sure that you don't have any added cramping, any added gassiness, any diarrhea or added diarrhea, because you already have the dumping to worry about, so you don't want to exacerbate that problem. So you start out low with 5 to 10 billion count and then work your way up to about 20.
Thank you so much. We have time for one more question. Is it important to find beverages that are naturally decaffeinated versus beverages that maybe have had caffeine removed through some other process?
It would be important, especially if you're concerned about any level of caffeine. Usually decaffeinated beverages still have some caffeine. For example, coffee, decaffeinated coffee typically still has about 3% caffeine in it. So if you're really trying to optimize your hydration, and especially if your fluids are limited, you really should have sources that are already naturally without caffeine rather than purchasing decaffeinated products.
Okay. Thank you so much, Cindy, for your responses to those questions. As you know, this webinar was brought to you by Debbie's Dream Foundation, Curing Stomach Cancer. Thank you to Debbie Zalman, President and Founder, our speaker, Dr. Cindy Collins from South Florida Radiation Oncology, and to Genentech for providing funding that helped make this webinar possible. As you see on your screen, we have upcoming events to get involved in and support. Details about these events are available on the Debbie's Dream website at www.debbiesdream.org. Thank you to all of our listeners today. Our next nutrition webinar will be held on June 10th at 12 noon Eastern Time. We would love to hear your feedback, questions, and thoughts before then. Please send your comments to patient.resource@debbiesdream.org. Please stay tuned for a clinical trial webinar starting momentarily.